In 1841, Dr. John Gout began to oversee the Eastern Lunatic Asylum in Williamsburg, Virginia. It was the first supported psychiatric hospital publicly. Dr. Gout introduced the talk therapy. Also in 1841, Dorothy Dix visited East Cambridge Jail and discovered terrible living conditions of the mentally ill, which were mixed in with other inmates, and believed they could be cured. Her efforts to remove mentally ill patients from jails led to the establishment of 110 psychiatric hospitals by 1880.
After War of 1812, reformers from Boston and New York had begun a crusade to remove children from jails into juvenile detention centers. It was established in 1842 and required asylums to be registered to the commission.
In the year 1995, the police started imprisoning people more and more. This happened in response to a higher crime rate. Then, by 2007, the U.S. residents incarcerated in prisons or jails were varied per 100,000 population. The 2011 IPS data showed that 10.1 million, 23% of the world were in the prison system.
On January 1st, 1970, asylums began closing down due to anti-psychiatry movement, feminism, political suspicion, and patient protests. Some patients were allowed drugs to help them, but many ended up homeless, treatmentless, and patients seemed forgotten and would often go mad.
In 2010, 450 white people per 100,000 people were getting in prison. Also, 831 Hispanic people per 100,000 were in prison. 2,306 black people per 100,000 were getting imprisoned. 30% of the population were people of color, but they make up 60% of people that are imprisoned. In our group opinion, when it comes to the topic of prisons and asylums, no progress has been made. When the funding to establish more asylums stopped, mentally ill patients were forced back into the population of inmates in the prison system. Most of the progress made was in the 1840s, but declined toward the 1900s and forward.